organization, and what interested you to join this webinar. What is it that interested you to join our webinar today? Please don't forget your name, your organization, and what interested you about this webinar. Please use our chat in there so that we get to know our participants. Okay, I think let us move straight into our presentations for today. We want to start with the introduction to the Eastern Africa Learning Collaborative. For those of you that don't know, Moses is here. Moses is going to take us through the introduction to the EALC. Please, Moses, you're welcome.
Okay, thank you, Dr. Asaba. Our dear participants, you're most welcome. And I just want to, first of all, talk a little bit about what we are abbreviating as EALC. EALC stands for Eastern Africa Agency Social Norms and Gender Learning Collaborative. It's a learning collaborative of practitioners, researchers, policymakers who have come together for purpose of advancing the work of social norms, gender, and agency. The learning collaborative was launched about 6 years ago in 2020 in partnership with the University of California to advance the work of social norms, gender, and agency. And it has been operational, bringing all these three different levels of stakeholders together. Of course, in 2024, the milestone that we had was that EALC partnered with the USAID, and then we launched one of the biggest global projects of advancing the agency across different initiatives in Africa and also in Asia and also in West Africa and East Africa. EALC membership is a membership collaborative, and the membership is free and is open to individuals and organizations who are based in Eastern Africa region. And what I meant by Eastern Africa include Uganda, Kenya, Tanzania, Rwanda, Burundi, South Sudan, Democratic Republic of Congo, and Ethiopia. So all these countries where if you are an individual or an organization who is working in policy, working in research, you are in direct implementation, you are actually a potential member of EALC. EALC structure is managed through a structure which is known as the Secretariat. Right now, the Secretariat is made up of 3 institutions. We have Makerere University, Institute of Gender and Development Studies, CARE International in Uganda, and Impact and Innovations Development Center as the Secretariat coordinator. And of course, the rest of the other countries, we have country focal point persons who work together with the Secretariat to mobilize the members. What do we do? EALC has basically 3 functions. The first function is to strengthen the documentation and sharing of learning experiences around social norms, gender, and agency work. And these learnings and documentation is around research, is around practice, and also is around policy. Number 2, we strengthen capacity. We work with our members to build capacities around research and implementation of the program itself on social norms and gender. And then 3, we improve practice through partnership that builds resources or share resources, but also continue to share the capacities. And then 4, we co-create on tools and documents that should actually support the work. And how do you join EALC? We have, of course, you register through in the individual registration form or organization registration form. And this, you can also have opportunity to learn more about our work, which is on social media. We are active on LinkedIn, YouTube, and also on X. So if you are not yet part of the EALC, we welcome you to join as an individual or as an organization, or you can contact any of us through the emails that we have shared with you, and then we shall be guiding you how to be part of this movement on social norms, gender, and agency. Thank you very much. Over back to you, Dr. Asaba.
Okay, thank you, Moses, for that very interesting introduction about EALC. I'm sure now our participants know what EALC is about and what it is doing. Next, ladies and gentlemen, we are going to have an overview of this study, mainly looking at the methodology and the state of evidence. And one of our presenters, that is Dr. Aloysius Nyombi, is going to take us through this. So, Dr. Nyombi, please, you're welcome.
Thank you so much, Dr. Asaba. So this presentation summarizes findings from an evidence review on interventions that intentionally shift social norms to improve girls' education and prevent violence in Eastern Africa. The review was conducted by the University of California, San Diego Center of Gender Equity and Health in collaboration with the East African Learning Collaborative that Moses has just briefed us on. So largely it synthesizes what we currently know about what works, how these interventions work, and where the evidence gaps remain. So this particular review builds on broader evidence review on adolescents and social norms. So working with the EALC and the Regional Technical Advisory Group, we focused on one central question, that is what works to shift social norms to promote girls' education, and prevent violence in Eastern Africa. So the intention was not only to identify the effective interventions, but also to understand the mechanisms through which social norms influence education and protection outcomes. I will take you through the 4 key questions that we addressed. One, first, what is the effectiveness of norm-shifting interventions in reducing violence against school-age girls with the intention of improving girls' education or the school climate, and what is the quality of that evidence? Second, we were interested in the mechanisms targeted to achieve change and which reference groups are engaged in that process. Third, what evidence exists on feasibility, acceptability, and appropriateness of these interventions. And then finally, how have these interventions planned for or achieved replication and scale up, and what challenges have they faced? Next slide. I'll now briefly explain how the evidence review was conducted. So we searched for studies published between January 2015 and June 2025 across Eastern Africa. And by Eastern Africa, I'm speaking about 13 countries. Both peer-reviewed and grey literature were included, covering quantitative, qualitative, and mixed methods evaluations. We searched for major academic databases such as PubMed, Embas, ERIC, Education Source, alongside Google Scholar and organizational publications to ensure that our search was comprehensive. As earlier stated, our review covered studies conducted across countries in Eastern Africa, and those were 13, from Burundi to Comoros to Eritrea, South Sudan, Uganda, Tanzania, Kenya, etc. So those were the countries that we covered. Let me take you to our inclusion criteria. Studies were included if they focused on girls aged 5 to 24 or had boys as allies or other key reference groups influencing girls' education. Interventions were eligible if they intentionally shifted social norms and attitudes related to violence, education, or the school climate. These studies also needed to report on measurable outcomes and had to include an appropriate comparison or evaluation design. Next slide, please. It was important that we define what we meant by norm-shifting intervention. Yeah. And these were interventions that either referred to a social norms construct or concept in the study justification or background, or they included a social norms construct in the theory of change, or measured social norms as an intentional outcome. So simply mentioning norms was not sufficient. Moving on to our search, the final sample. So our search initially identified 5,667 records. And after removing the duplicates, which were 1,517, we had 4,150 articles to look into, or book chapters and other material to look into. And after a rigorous process of screening, and applying our inclusion criteria, eventually we included 94 articles. And these 94 articles represented 74 unique interventions. And later on, as we are presenting the results, you would see a number 74. So even though the final sample of articles was 94, 74 unique interventions were identified due to multiple articles speaking to one intervention. I'll now turn to what the evidence tells us. So one of the first observations is that social norms are widely acknowledged, but not always systematically integrated. If you look at that particular slide, you will see that around 3/4 of the studies discuss norms in the background. Kindly go back to the slide before. Yes, that one. You get to see that around 3/4 of the studies discuss norms in the background, and nearly 2/3 describe strategies to shift them. However, fewer than half actually measured changes in the norms, and only about 1/3 clearly identified the relevant reference groups. So this suggests that while norms are increasingly recognized, they are not yet consistently operationalized in intervention design and evaluation. Next slide, please. Looking at the study design, we also were interested in the study design used to evaluate the interventions. So the overall quality of the design is encouraging. You would see that nearly half of the interventions were evaluated using rigorous experimental design, including RCTs or cluster randomized control trials or quasi-experimental approaches. So this really strengthens confidence in the evidence that we are going to present today. Next slide. So the other thing that should be of interest to us is the question, did the studies measure norms? So despite the emphasis on social norms within our evidence review, we found that only 45% of the studies actually measured them. And the other interesting finding is that most combine norms with attitudes rather than treating them as distinct constructs. And actually, very few measured norms on their own. You could see that only 4% measured norms on their own, which means that nearly 1 in 5 studies did not measure, but also we found that nearly 1 in 5 studies did not measure norms at all. So this points to a very significant methodological gap and underscores the need for stronger and more consistent approaches to measuring social norms in fisher research. So in summary, the review shows interest in norm shifting interventions, that there is that growing interest in norm shifting interventions, and this is supported by increasingly rigorous evidence. However, there remains important gaps in how social norms are conceptualized, measured, and incorporated into program evaluation. Now, I will hand over to the next presenter who will discuss the findings in greater detail. Thank you.
Thank you. Thank you, Aloysius, for taking us through the study overview and the methodology. We are now going to delve into the results, ladies and gentlemen. Part one of the results, which is going to be presented by Dr. Ann Kisa. Dr. Ann Kisa, please, you can start on your presentation.
Thank you very much. For the first part of the results, I would like us to take about 20 minutes to see what we found from those 94 articles from the 74 countries. And I would just like to urge everyone to drop their questions in the chat, even as we discuss along, and we will deal with them at the very end, including what Aloysius has just presented. So we got the evidence from different interventions and results from 9 interventions that took place in both an EALC country and a non-EALC country, but only 1 intervention that took place in more than 1 EALC country. But most importantly is that 86% of these review papers or evidences that were included were from 1 country only, and only 12% came from several countries, showing a limitation of how many interventions are across multiple countries. But as you can see on your map, we had evidence from Ethiopia, Kenya, Tanzania, Uganda, that were included in the review, and also some papers from South Sudan and Rwanda. The bulk of these papers, as you can see, are in Kenya, followed by Tanzania, and then Uganda. And later on, you will see some of those similarities and differences in another section. Next slide, please. Thank you. When you look at where the interventions were focusing on in terms of the topics, between shifting harmful norms and versus amplifying positive norms, you find that of the 74 papers, at least 18% of these papers are addressing a shifting of harmful norms. But 43% of this are addressing both shifting of harmful norms and supporting beneficial norms, which is preferable. That there is a reduction in the harm, but there is also an increase in what's positive and supportive. And 11% of those evidence pieces are addressing supporting of beneficial harms. Next slide, please. The norms, in terms of subsets of norms, norm shifting interventions or NISIs, about 60% of these interventions aimed to shift gender norms, followed by violence. But then there was a lot also around girls' education and sexuality and reproductive health. Interventions that are commonly addressed here show you what is being a priority in the last decade or so in the evidence that's being produced, but also the interventions that are being implemented and evaluated on. When you compare to things like agency and voice and decision-making, even though they are powerful, they're lagging behind. Next slide, please. In terms of reporting, the programs identified reference groups that were being focused on. And in terms of reference groups of adolescent girls and young women, 51% reported how adolescent girls and young women groups were identified, some through formative research, some through consultation, but others through just norms mapping and conceptual mapping. And the most identified then through formative research and consultation processes is still low, and yet reference groups are important in interventions in identifying who is meant to be in the intervention, performing the intervention, or both. And desk reviews were really less frequently used, if at all, at %. This desk review one of the most important missing pieces of information. Next slide, please. In terms of the adolescent girls and young women reference groups that were now included in the intervention, one of the major groups that were included are parents, followed by adolescent boys and young men. And you will notice that these categories are not mutually exclusive, in that in one intervention, you would find that both parents and adolescent and young men have been included, or sometimes teachers and parents have been included in an intervention. But parents overall, parents and adolescent boys and young men and community members were most commonly included in the interventions, at least in 37 of them. Next slide, please. When it comes to the place where the intervention took place, we considered several places that emerged, for example, in school or in homes or even in communities and clubs and groups. And here you see that school was the most popular site of interventions at 72%, and some interventions about 54% in the community. Again, some interventions were both in school and at home, or in school and in community social spaces. Next slide, please. The individual settings are not mutually exclusive, but when you look at what strategies the interventions used, the most popular strategy being used here is education or curriculum-based interventions. At least 41% of the interventions used more than one strategy, combining, for example, education and role modeling, or education and interpersonal dialogue and role modeling. But as you can see across all the papers, the most popular were those three, followed by other means like traditional media or even empowerment approaches and cash transfers, which were all below 25%. Next slide, please. When it comes to the scale of the intervention, some of the interventions, implemented in a limited number of sites, or maybe just facilities, schools or districts, but some are nationwide or even regional interventions. When you look at this graph, you see that about 19% of the interventions, about a fifth, were national interventions. But then regional interventions, about another fifth, but a third of the interventions are pilot interventions, the ones that are done at a small scale, implemented in a limited number of sites. When it comes to regional or multinational interventions, those were very rare and very few, at just about 5% of the evidence that we accumulated. Next, please. Thank you. About a third of these interventions, as you can see, were not reporting the duration of how long the implementation took place, but overall about 20% or a fifth of these interventions lasted less than 1 year, or they were very interventions. Long-term interventions were also interventions that talk about how long that, whether that was once off or several months, were very rare, and this is a significant gap in the literature that needs to be addressed in future. If you could move to the next slide, please. We will see that stakeholders are involved in intervention design or adaptation. This is a bit different from the reference groups. Now, when it comes to stakeholders, implementing organization staff or team members were the majority of those who are involved in designing or adapting the intervention. Our interest was to see whether adolescent girls and young women were also involved in designing the interventions. We see that often community leaders and teachers were involved more than the adolescent girls and young women themselves, and parents at least had a part or full say in how the implementations were designed. Only a third seemed to engage the adolescent girls and young women for designing interventions for them and about them. Next slide, please. Next slide. Thank you. So the interventions sought to benefit at least 54% being adult girls and young women. But as you can see, there are other interventions. Okay, should I switch off the video, Richard? All right, okay. The interventions sought at least to benefit adolescent girls and young women in 54% of the times, but you can see that about the other half were targeting both adolescent girls and also adolescent boys. Beneficiaries were largely school level, at primary school 58% and secondary school
Anne gone off. I think Anne could be having challenges with her network.
Slide.
Professor, can jump in.
Which slide it is?
With numbers.
Because they are not clear there.
She was still talking about the who the intervention sought to benefit. We don't know that she's going to come back in, but
Okay.
maybe Professor Eddie Walakira, could you continue as we wait for her to come back?
To wait for Anne to come back, you can see that majority of the beneficiaries of the interventions were primary school going students or children or young girls and boys, followed by some articles were not so clear about followed by secondary school goers. And then you can see that there is a very big portion of those for whom it was not very clear, about 15%, and so forth. But in general, interventionists, beneficiaries are the individuals or groups for whom the intervention was designed to benefit. So that one, we should be aware of that. And this may not always be the same group the intervention actually engaged. So just to have that at the back of your mind. Then we can move to the next slide. So who participated in the interventions? The adolescent girls and younger women were the majority, 85%. And the list goes, followed by the adolescent boys and young men by 42%. Then the list participants, as you can see at the foot of the slide, are the male partners by only 1%. So we have to think about it. Was it intentional? Was it a mistake? Yeah. But just to wrap it up, most interventionists engaged adolescent girls and young women, and men engaged more than one set of actors. That is what we get broadly from that slide. So we move to the next one. So who did the interventionists seek to influence? Yeah, mostly the adolescent girls and young women. Again, similar to what we saw in the last slide. But with a slight change here, you can see the targeted parents by 50%, and then followed by adolescent boys and young men. So those are the three major categories. But at the foot of the slide again, you can see faith leaders and male partners were the least categories that the interventionists were at the foot, were the categories that the interventionists least sought to influence. That is what I wanted to say. But if you can wrap it up, almost all interventions targeted adolescent girls and young women. That is what we see mostly. Yet social norms are maintained by reference groups, which makes it essential to engage those groups to create a more enabling normative environment. Next slide. So which outcomes did the interventionists assess? Some technological issue here. So I mute this. So. All right, which we are sorry, the technology sort of, which outcomes did the interventionists assess? Ideally, primarily, we measured all the interventions assessed or targeted for outcomes. Number one, which was the most predominant, violence prevention. And number two, promoting girls' access to education. And number three, shifting or changing the attitudes. And number four, shifting particularly the negative social norms or amplifying the positive social norms. Yeah, they are trying to fix, but I have access to slides here. Should I continue or I wait for you?
You wait and they project the slides.
So just to wrap it up, as we sort out our technology, out of the 74 interventions we identified, 72 reported outcomes related to those major variables or outcomes which I've listed. Of these 72 interventions, 52 reported outcomes across more than one outcome category, and 27 reported outcomes across all the four categories. So we move to the next slide. All right. So as we can see, that one can move this one a little bit. Now, most interventions aim to influence multiple outcomes, which I think is a very positive thing. And if you look at those samples. It is a very beautiful picture. They give you a very clear, intention of these interventions. But 1/4 of evaluations measured violence, education, and social norms, making this the most common combination of outcome areas. A few evaluations focused on a single outcome. Again, you can see the chart brings it out very well, rather the figure or the image, suggesting that intervention is typically sought to address multiple dimensions of adolescent girls' well-being. Next. So feel free to note your questions and insights in the chat for discussion, for questions and answers. Thank you.
Okay, thank you. Thank you, Prof, for filling in for Anne. We are sorry Anne went off because of technology, but as you see on that slide, we encourage you to continue noting or writing your questions in the chat. I see Migisa and others have raised quite a number of questions. Please take note, we have a session. The questions and our presenters will actually have time to answer. So feel free to send your questions in the chat. We shall be able to discuss those questions. We have a session dedicated to that. Finally, Anne is back. And you're welcome. Sorry about that. We know technology. But Professor Olakira filled in for you, so it is all right. It is all right. Okay, so I think now it's time to move on to the part 2 of our presentation, which is going to be presented by Professor Olakira again. That is part 2 on intervention effectiveness, ladies and gentlemen. This part is on intervention effectiveness. Remember, we have just discussed intervention design and implementation, which was presented by Anne Kisa and partly by Professor Eddie Olakira. So now we are going to move on to part 2. Let us first get the slides ready so that you can follow presentation. So once we are ready with that, then Prof will come in. But for now, give us a few seconds and we project or we show you the slides. Part 2, if you can move to part 2, that is intervention.
Slide 31.
Is that slide 31?
Yes.
Yeah. Okay, so slide 31, I think.
48.
48, right? Okay. All right. I think we are now ready. So
We go to the next.
Prof Olakira, please, you can again come in and give us your presentation.
All right. Thank you so much, Dr. Sava. I'm presenting about the intervention effectiveness. How did we establish it based on the articles that we evaluated? Now, we coded an intervention as positive if the results were statistically significant in the positive direction. If the findings or results were not statistically significant, then we coded that as neutral. And we coded it negative if the results were statistically significant, but in the negative direction. And that is now for the quantitative articles that we looked at. But for the qualitative articles, if the results were interpreted in a positive direction, yes, obviously, we went ahead to code that as positive. And if they were interpreted, with the indication that they were taking the negative direction, that is also what we coded. And for neutral, was neither positive nor negative in terms of the direction of the intervention. So we move the next one. So we have a question here. What is the effectiveness of interventions across outcomes? Because this is a very pertinent question. But what we see is that across the 4 outcomes, you can see that the interventions were most effective in the area of violence prevention, followed by those that targeted improvement of education outcomes for the girl child. And the list continues. Changing attitudes was number 3, and the least area of change in terms of positive outcomes was social norms change. So we go to the next slide. So how effective were violence prevention interventions across settings? So if you can modify the question a little bit, if you wanted to reduce violence against the girl child, which of those 3 settings would you most likely get the highest impact, positive impact? So what we see here is that all of those interventions within the school setting yielded the greatest impact, followed by those that were implemented within the communities. But also, there were interventions that had much more than one setting, and you can see the score was 47%. So for those of you who are involved in implementation, I think this one gives you an idea. If you wanted to reduce violence for the girl child, then you can see where you can put your greatest energies. Okay, the next slide. Okay, thank you so much. So how effective were education interventions across settings? Now, education interventions were most effective, and this is surprising, where they targeted communities, or where we can say they were community-based. What do we define as community? It is a very tricky question in terms of boundaries. But if you have a collection of families, collection of households, or cultural communities, or geographical communities, as long as it is not one household, as long as it's not an individual, that is a community. And the intervention is to promote education for the girl child. We are most effective within the community settings. Now, the second area of impact in terms of settings were multi-settings. So possibly here now, it gives you an indication that if you target more than one setting, also the chances are high that you are likely to get to yield or to establish to register positive outcomes. And finally, which is even very surprising, if you wanted to promote the education of the girl child and you went to the school, within the school, that is where you are least likely to get the positive outcomes because they already at school anyway. So the outcomes there will be maybe retention, will be performance, etc. But now it gives us a very good picture of where the articles that we reviewed showed where the impact was highest. Thank you very much. So which norms shifting strategies were most often associated with positive effects on violence prevention? What you see is interpersonal dialogue as the most effective in terms of shifting norms that perpetuate or that promote or fuel violence against the girl child. What are these interpersonal dialogue, strategies? That is the question we have, but we can shed more light. Maybe there are small groups, they could be peer groups, they could be community dialogues, they could be, male groups or female groups, etc. But as long as there is interpersonal communication. Now, the second area of impact was role modeling. Again, as you can see, if, for example, you are working with the parents and you teach them about good parenting, and then you show who the good role models are, or if you are to talk about male models, then it shows you that this one also can have a slightly higher impact compared to other strategies. Then these two strategies, use of education / curriculum and use of traditional media, they tied. So if you have to use TV, radio, the impact is likely to be the same, based on these articles anyway, together with when you go to school and mainstream issues of violence prevention, gender-based violence within the school curriculum, or even mobilize teachers and students and talk about these issues. So that is the picture that we get from that slide. Next. So which norms shifting strategies were most often associated with positive effects on education? Friends, shifting, especially negative social norms, is not an easy thing. But here we have an opportunity to peep into what the articles revealed. So if you want to promote education by shifting negative norms, social norms, or amplifying positive social norms, where do you put your attention? Role modeling came out as number one, followed by interpersonal dialogue, actually which tie together with education / curriculum. And use of traditional media came last. So now you know where you can focus a lot of your attention, although the differences don't seem to be really so big. In terms of promoting education, that is the picture that we get. How did the effectiveness of violence prevention interventions vary by duration? And if you ask it in a different way, what should be the duration of interventions that are likely to create more impact? So which interventions by duration create the greatest impact? I'm trying to make it very easy for us to understand, those of you who are in implementation science, so that we don't complicate it. What do we see here? Those that lasted, the intervention that lasted 1 to less than 2 years had the greatest impact, followed by those that lasted less than 6 months. And again, you see those that lasted between 2 less than 5 years had nearly 50% level of success. Well, that is the picture, but at least we have an idea that those that had a shorter duration predominantly had the greatest impact, that is in terms of reducing violence. That is what we see. Move to the next slide. What about those that aimed to promote education? Which ones were most effective by duration? And as all of us know, if you were to support the girl child education, those interventions won't be very effective if they have a shorter duration. And this is exactly what this slide tells us. But if you have more years or more time, between 2 to 5 years, 5+ years, you can see the percentages are quite high. So you need more time to realize positive outcomes in supporting the girl child education. So how did the intervention effectiveness on social norms and attitudes outcomes vary by duration? This is the last slide we have on intervention effectiveness. All right, you can see if, for example, you wanted to combine attitudes and social norms, anyway, before even I go into that area, where you see 6 to 12 months, or less than 12 months, there the impact was high in terms of reducing, maybe let me put it this way, negative attitudes that undermine the girl-child education. The duration is 6 to 12 months. And when it comes to social norms, they are registered at 43% level of success. But if the focus was largely on shifting social norms, although the distinction is there, but many times also many things go hand in hand. Between 2 to 5 years, which I think is very realistic, that is where you are likely to have the greatest impact in shifting negative social norms that affect the girl child, the education of the girl child, or even increase the experience of violence for the girl child. So that is basically what we get. Variations can be seen across different time periods. Right. Thank you very much. Feel free to put your question within the chat area, then we shall come back to it. Thank you so much, moderator.
Thank you, Professor Olakira, for taking us through intervention effectiveness. I see people have been taking note and asking questions already in the chat. Relationship between attitudes and norms and etc. Please, Megisa and others, we are going to have some minutes to discuss these questions. We are going to have a Q&A or question and answer session. So don't worry, that is coming in. So having completed the intervention effectiveness part of our results, I think now Anne is back online. Anne, are you there?
Yes, Prof. I'm right here.
Okay.
Yes.
Okay, great. So
Let's proceed.
allow us to... Sorry?
Please continue.
Okay. So we are going to take you through the last part of our results, which is a comparison between Kenya and Uganda, a comparison of the interventions between or across those two countries. So Anne is going to take us through this section of the results for about 10 minutes or so. So please don't get tired. This is very interesting. Let us listen to Dr. Anne Kisa again.
Thank you. About our comparison of similarities between Kenya and Uganda, how were these interventions implemented? If we begin to think about the individual settings that are exclusive or setting categories that are not mutually exclusive, we will see that the school setting had many more interventions than interventions. Sorry, I think we had a hitch on that presented slide. We had the school setting had many more interventions in Kenya compared to Uganda, but the difference is very little at 88% in Kenya, at 77% in Uganda. But overall, you're seeing that across Uganda and Kenya, the school setting, I think you want to be looking at the previous slide, the first one. Your slides are moving a bit quickly. Where were the interventions implemented? School setting, 88%. If we look at the current slide being projected in the top 8 intervention strategies by country, you will see that across Uganda and Kenya, education or curriculum as one of the interventions had the highest percentages. just a 4 difference percentage point between Kenya and Uganda, followed by role modeling, which is another very popular strategy in both countries, but they are showing a bigger difference in terms of the interventions that are seen coming out of Uganda, that were using a lot more interventions for role modeling at 62%, and Kenya showing less percentage for role modeling at 30%. If we could just keep it there a bit, it's moving a bit much. If you look at interpersonal dialogue, the difference was little between Kenya and Uganda at 54%, and at I think your slide disappeared. Should I keep speaking or I should wait a bit?
Yeah, just a second. It's getting fixed.
Yeah, they moved quite a bit.
You know, the
would you like me
technology,
to
that
share?
is what happened. Okay, we are getting it back in a second or so. So,
I was just explaining that if you look at the individual settings where things were happening, you realize that the top 8 interventions or strategies were education or curriculum based, and then role modeling, and then interpersonal dialogue, and then public change or public pledges. But when you look closely at role modeling, you find that most of this was more popular in terms of interventions in Uganda than in. But when you look at interpersonal dialogue, then you had more a closer population Uganda and in Kenya. And then when it comes to public pledges or community-wide changes, then a lot more interventions in Uganda than in Kenya. Let's look at the previous slide, please. Is it the next slide?
Yes.
Frequently engaged. Sorry, your slide moved again. And this we have dealt with. So another slide, kindly.
Yeah.
The most frequently engaged was school personnel, who are the primary actors for intervention participation in both Kenya and Uganda. You would remember that one of the most popular settings for interventions was schools in another slide. And naturally, therefore, you see school personnel here being quite involved in both countries, followed by school administrators, the teachers, I mean, followed by school administrators. But when it comes to now who is directly engaged, you see that adolescent girls and young women, which has which was again the most directly targeted participants, a slight difference between Kenya and Uganda, that 92% of interventions that were involving adolescent girls and young women as directly engaged were from Kenya, and about 37% were from Uganda. So a most popular participant overall, but with about a 20 percentage point between the two countries. When it came to teachers, however, the disparity was bigger. Kenya having 31%, but Uganda having 77%. The teachers are not as involved in Kenya as in Uganda when it came to the participants. When it came to adolescent boys and young men, and this has elicited quite a reaction in the chat in terms of them being intervention participants. You see that both countries had about 42% in Kenya and 46% in Uganda as engaging participants. So among participants that are engaged outside the school environment, the parents now were the most common group, but within the school environment, you're seeing adolescent girls and then the teachers. Another slide, please. Can it be? There we go. I think it's coming slowly. So which norms did interventions address most frequently? Gender-related norms were the most commonly addressed norms that we agree we have seen even in the other slides. But violence norms in Uganda, while girls' education-related norms were prominent in Kenya. If you look at the violence-related norms here, you see we have Uganda at 46%, and you're having Kenya at just about 35%. Overall, it's still below 50%, but you see a slight difference there. But then the gender-related norms, both countries' interventions are addressing it almost equally. Things to do with agency voice and decision-making are at 15% in Kenya and 8%, just about half of that in Uganda, which is quite a disparity if you think about it. But also in girls' education, which we expected would have been, the evidence would have shown both are balancing, you see that girls' education is at 5% evidence in Kenya, but Uganda had about 15%. It could be many of the scenarios. You would recall that this was a systematic review, that we were just looking at the evidence available and the evidence that does exist. It may be that the interventions are there, but the evidence is not being published, or it may be that they're not there at all. And that is part of the discussion that follows after here. I would like to stop here, Prof, and hand over back to you for a more substantive now discussion across the entire presentation. Over, and thank you very much for this opportunity.
Okay, so thank you very much, Dr. Ann Kisa, our presenter of results part 3, a comparison of Kenya, Uganda. So just as a reminder, ladies and gentlemen, we've gone through the entire study, the reason we are here, the entire evidence review. We had an overview of the methodology and the state of evidence. After that, we moved on to the design, the implementation. Then we moved on to the intervention effectiveness. We've just had the comparison of what is happening in Kenya and Uganda. So I see there are quite a number of questions on the chat. I think we are going to open it up now for questions and discussions. But I think there are some burning questions in the chat. If you can allow me to start with those, and then people can be free to raise their hands after that. So our presenters, please, Dr. Ann Kisa, Prof. Walakira, and Dr. Lozias, please, these questions are yours to answer. We can choose, or you can choose who will be able to answer these questions. Let me go into the chat. I will start with, I see, I'll start with a question from, yes. Is it Migisa Kaba? Yes, Migisa Kaba. must be coming from Ethiopia, right? So Mugisa Kaba is asking, thank you, Mugisa. Again, how such rooted factors that anchors and sustain prevailing problems could be intervened needs to be worked out. Routine interventions that we know of may not help. I wish this collaboration can chart out guidance for interventions. What was the intervention targeting adolescent girls and young women who themselves are victims of social norms? I don't know who will be answering that one. Is it for Aloysius or for Prof? Answer?
Question.
Yeah, may I clarify? Sorry.
Please clarify.
Yes, thank you so much. Thank you indeed for an interesting presentation from every speaker. Much appreciated. I mean, listening to all the presentations, my personal feeling is how was social norms understood in the first place. In as far as my understanding goes, social norms are actually, founded in the society, in the community, if you wish, and they are actually sustaining problems, be it violence, limited girls' education, perhaps, public health service utilization, female genital mutilation, and so on and so forth. So, addressing those problems, I would say require a different approach, a different tool, and certainly research on those would definitely require, perhaps different methodologies, approaches, and so on and so forth. So I just want to know, the overall understanding in this process, number one, and secondly, how is it that this collaboration, East African learning collaboration could actually contribute to improved, approaches in addressing social norms? And because, addressing that one would be fundamental in the whole process of dealing with public health problems, in particular, and problems in, at large. That's what I'm referring to. Thank you so much.
Okay, thank you, Mugisa Kaba. I think our presenters have taken note of that. The next question we have here is from Edward Biketi, unpacking and contextualizing norms in agribusiness guessy work. I keep running into 4 deep-seated norms. Who counts as a farmer? Which crops are women's? How productive and reproductive work get divided, and who actually controls resources, benefits, and household decisions? The fix isn't attitude change, it's social expectation change. DFID's framework nails this. Number one, shift what the group expects, not just what individuals believe. Number two, publicize the shift to it's visible. And number three, reinforce the new norm until it sticks. As Alexander Spot et al. Put it, change only holds when it resets what the people who matter to you expect from you, not just what you privately believe. Interesting question there on the focus on attitudes. I think our presenters will discuss that. I saw Rebecca Landgren responded here. I think we are discussing this, or we have already discussed it, or we are going to discuss it. And thank you for joining in, Rebecca, from UCSD. Then we have another one from Steve Owaga. It is interesting that we are talking of norm shifting, yet men and boys who are the beneficiaries of these norms are standing at 1% as the beneficiaries of the intervention. But I guess this is due to the fact that most of these interventions are donor, interest, and focus driven. I don't know if that is the reason for the low involvement of of men and boys. We can discuss that. These are 3 questions. Maybe we can take one more and then allow our presenters to respond. Yes, Regina Naloga, what are the criteria for considering a norm positive or harmful? Pause. Each norm is culturally supported for society well-being. Well, gender-based violence is rooted in harmful norms, but our presenters are going to discuss that. That was a short one. So I think at this point, yes, there's another one short one again. I'm not sure if schools create and protect social norms, for example, that sustain sexual violence. This is again from Migisa Kaba. Thank you. I think Aloysius has been trying to respond to some of these questions. And I think Rebecca chipped in there. So, who goes first? Aloysius, you want to come in first to respond to some of these questions?
Yes, I'll speak to, hopefully I'm clear enough. I'll speak to Magisa's first question. And his question is around, if I got him right, do we have the same understanding across different stakeholders on what norms are, what norm shifting interventions are, what norms programming is about, and the question of what is the EALC and the Learning Collaborative in doing about this, to help people understand norm shifting interventions, norm programming, and what norms actually are. I should say that we have quite a number of materials that can support agencies and other stakeholders to see, to understand, but also we also have materials that provide a step-by-step guidance on how to do this. I'll mention a few, but I know my colleagues will put a link in the chat that can help persons to access those particular materials. For example, we have the Social Norms Atlas, and it defines norms and other key norm concepts. But also we have the Social Norms Exploration Tool, which provides step-by-step guidance to project staff who intend to either integrate or come up with norms programs. Yeah. And other materials that can be accessed by different persons. So I think what we need to do more is to see that we publicize, we share these materials to support agencies and other stakeholders to familiarize themselves with norms programming, and designing of norm shifting interventions. And that takes us to the key question, I think, which is coming here and then. The question around, yes, these particular studies might have included norms construct in the background, in the methodology, but also the outcomes. But still the question is if they were indeed implementing a norm shifting intervention and reporting the same. Yeah. So those are the things that really we need to go into and have a deep discussion. But regarding material, it is available, and we are going to share these links to such material. Thank you.
Okay, thank you, Dr. Aloysius. I saw a hand from Dr. Ann Kisa. You want to respond to another question?
Yes.
Okay, go ahead.
Thank you very much. And I saw the comment and, of course, the question around men's and boys' involvement in terms of interventions, and whether this was because it's donor-driven kind of programming, or what could be the reason. And my response to that is that, remember, this was a systematic review of what has happened and what is the evidence available in the last 10 years, and surfacing that gap. and as norm and as is the norm, systematic review then points us to what is the evidence currently, and in the evidence, what is being shown to, and in the evidence, what is missing. And therefore, you can see glaringly there is a missing link there in terms of interventions that target adolescent boys and young men as participants and as beneficiaries. So then what is missing in evidence is how may those interventions even be designed to be effective? How long should they be? What type should they be? What ought to be done? So I think that question proves to us we have surfaced the gap and the question, but it also proves to us that there is more work to be done. So thank you very much for eliciting that question and putting it at the forefront. Indeed, as with all systematic reviews, we only present what we found that exists. And if you see that there are other areas even beyond this that don't exist, please let us know so that we will now be in a position to complete evidence-based, or rather aim to find that evidence. Thank you very much, and over back to you.
Okay, and thank you very much for your response. I think Professor Olakila wants to respond to some of the questions as well. Please, you're welcome, Prof.
Yeah, thank you so much, Dr. Saba. One of the participants made a statement that schools cannot promote norms that harm children. I'm just paraphrasing it. So this is my response, although I'm not responding on the basis of the articles, because we reviewed the articles and what we are presenting is based on
that's
mentions.
Yeah.
And let me just give this general information. First of all, in our context here, Uganda, Kenya, Rwanda, etc., schools are centers of discipline. As such, traditionally, parents and teachers expect that disciplinary measures will be taken to ensure that children do not misbehave. This therefore can perpetuate violence against children, especially corporal punishment and other forms of punishments. And I think it has been upheld. It is the common, it is very common within schools. So for someone who was thinking that they can't, promote norms that harm children, just take a note. Number two, schools also develop cultures that can be beneficial but also harmful. Schools are not expected to accommodate girls who are expectant, especially within most of the African countries. This affects the girl child education, especially when it comes to re-enrollment and reintegration of those who are expectant. So it affects their education. And finally, although schools are centers, are learning centers, they may not promote certain subjects, for example, on sexuality. There are both views for and against the teaching of comprehensive sexuality. And I think this one can be evaluated to see which way to go. But schools also are not islands. They have individuals who come from communities with entrenched negative social norms, although they can also have positive norms. So just bear in mind that all of those things can happen and can affect the girl child.
Okay, thank you, Prof. I don't know whether this question of the limited involvement of men and boys has been handled. I think it was also asked by Mikisa, if I recall. Do you have any response to that based on the review that there's that limited involvement of men and boys?
I can give a little response to that effect. I think for those of you who are practitioners and you're online, this is exactly what, it shows exactly what takes place on the ground. It is a reflection of what we are doing and what we are not doing. But generally, there has also been a preference to target the girl child or the female gender much more than the male gender. So I think that is the imbalance now, which needs to be addressed. So for us, we're only bringing out what we saw from the articles. That is for you now to take a note and make sure that there is some bit of balance.
Okay, thank you, Prof. Actually, that question was asked by Steve Owaga, saying that beneficiaries of these norms are standing at 1%, the men and the boys. Okay, I think that is also what is happening. It's a general observation when it comes to the fight against GBV, the limited involvement of men, and this review has actually revealed that. So as practitioners, like Prof has said, we need to do more with that gender. I saw a response also here from Rebecca from UCSD, emphasizing that adolescent girls and young men are influenced by social norms created and enforced by others in their society. So a norm-shifting intervention would not focus primarily on girls, but on caregivers, teachers, faith leaders, etc. Just trying to emphasize actually what we've said. And Aloysius, your hand is up, please. You want to say something?
Yes, and I just follow up on what Rebecca has said. That if we are speaking about norm-shifting interventions, we can't leave out the reference groups that uphold these particular norms in the society. So that is one of the things that we need to really focus on, and the rest, Rebecca brings it out well.
Okay, thank you, Aloysius. I think we can move into the other questions that we have here on the chat. Okay, for considering this was answered by Aloysius. Okay, even the one of schools. Okay, we have a question from AFHI. One of the challenges to measure social norms based on contextual factors is the lack of standardized measures by the implementers. In your study, did you come up with such examples of poor measurement approaches and methodologies, despite the fact that interventions are targeting norms change or transformation? I think our presenters did not project them as, I would say, poor measurements, but I'll leave that to them to respond. Maybe gaps in the implementation, but they are there. So AFHI, that question is going to be answered. I see Rebecca also responded here that harmful or positive norms of the education and violence outcomes, the review focused on, e.g. decreasing violence, increasing education. So that was just a point, I think, to note. Again, AFHI, just curious if also some data was collected in refugee settlements where social norms are prominent in some countries for learning purposes. Yes, whether data was collected in refugee settlements. So that is also going to be answered. That is our second question. Then we have another one. Okay, somebody has already answered that 3 of the interventions included in the review are in the refugee settings. This is Marian, but our presenters will respond. Okay, this is by Rebecca again. I think I will skip this one. She was also trying to respond that, as we saw in the method slides, less than half of the studies even measured norms, fewer in this in a standardized context-appropriate way. Okay. Migisa wants to know the relationship between attitudes and norms. Okay, and I see Aloysius responded that norms shape attitudes and attitudes can reinforce norms or challenge norms, depends on one's agency. We don't have strong evidence from the review on the same. This is drawn from, of course, this is drawn from his own practice. So just for you to note that norms shape attitudes and attitudes can reinforce norms or challenge norms. And that is why there is always that focus on attitudes as well. So that's why many studies on norms actually will have to include attitudes. Stephen again is asking, Steve Owaga, norms, values, and attitudes form a hierarchical chain. Values are deep-rooted core beliefs about what is good or right, e.g. equality. Norms are the unwritten rules and expected behaviors that emerge from those values. Attitudes are personal evaluations of feelings towards a specific object, person, situation. And he concludes here by saying, essentially, values shape norms and together they influence and reinforce individual attitudes, creating a feedback loop where attitudes can gradually shift norms and reinterpret values over time. Maybe this is for noting also, emphasizing what we've talked about, that norms and attitudes go together. Maybe I missed it. Rogers Tumsime is asking, is disability also captured in this study? Please, our presenters, is disability also captured in the study? Okay, Anne has already responded here, but maybe to emphasize later about disability. Okay, Rebecca also responded that yes, that is an important question, and we have not unpacked that in this data, although 41% of the studies looked at both attitudes and norms. So it is an area to dive into more in this data set. But more generally, the evidence is not definitive on this question on how they are interrelated or shift over time and influence behavior. Okay, it seems to depend on the context and type of outcome, e.g. violence, FPUs, etc. And she concludes again by saying, importantly, given the nascent state of norms measurement, it is difficult to unpack this relationship. Again, Steve Owaga, what's the possibilities of programs reporting favorable impact results for short implementations due to the need of showing it's working with an expectation of continued funding, since most development partners give short contracts of funding? I hope this can be answered, our presenters. The possibility of programs reporting favorable impact results for short implementations. We had a slide on that, on duration. How did you come up with that list of norms to study? This is Immaculate Mukasa asking. How did you come up with that list of norms study? But Rebecca has also responded that these were norms from the studies pulled from the review. So I think we can respond to those questions. Our presenters who would like to go first. Prof, you want to go first this time?
No, I'm not so sure of which to address.
You know, I saw you taking notes, so.
Yeah.
Rebecca, I think let me ask Rebecca. Okay. Aloysius.
Yes.
Okay, Aloysius, please go ahead, and then we shall give Rebecca an opportunity to say something as well.
Yeah, just a small note that the issue of norms measurement is quite something that so many organizations and stakeholders are struggling with. And we have a couple of norm measures that exist, frameworks that exist, including the ACT framework developed by, is it UNICEF? And I don't remember the second agency, and to do with female genital mutilation, but also there is a SNAP framework, social norms analysis plot by CARE International. Yes, so there are those norm measures, but still there is growing arguments around these two and their effectiveness of in guiding agencies in developing norm measures. The good thing the East African Learning Collaborative, together with other collaboratives, is now offering a norm measurement training, currently training trainers of TOTs. So these are some of the works that we are trying to do to see that we support organizations and different individuals working within those organizations to get this information around norms measurement. Yeah, that's what I can say about that specific questions around if really these different studies were indeed measuring norms or it was something else. So it's much broader than what we saw in the studies. It's a much broader problem that we need to tackle as the Learning Collaborative. And indeed, we have started working on that.
Great. Thank you, Aloysius. Anne, do you want to say something before Rebecca can come in? Did you raise your hand, Anne? Okay.
Really?
Anne is not, okay, yes?
But what I was saying was that you have seen the depth of evidence available, and less than half of the 74 interventions were measuring norms. And even fewer of those particularly address some of the questions being raised by the audience today in terms of scientific and practical curiosities, meaning that we have identified possible areas that we need as an EALC collaborative to find evidence for. We have identified those areas, but we have not said these are the only areas. There is a lot more. And as we are seeing, there's a lot more around. I've seen somebody's focus on disability. Even as we think about norm shifting and violence, what about disability in there? So feel free to, even after this, raise those as possible areas of further inquiry. Because they really are relevant to society here. Just to mention, these are things done the past 10 years. But if we think about the next 10, then this is the right time to also show the other was disability, but the other one was about men and boys. And that seems to be also a hard nut to crack that we can start now. Over to you.
Okay, thank you, Anne, for highlighting that issue of disability. I was also thinking of how we can include or can have inclusion in the measurement of these norms. I don't know, that is something for us and the Secretariat to think about. Rebecca? Rebecca,
Yeah,
please.
thanks, Richard. I was just going to add, I think everyone has covered this really well, but to what Anne just said is that there were 4,000 articles that said they were addressing gender, either in the title or the abstract. So out of those 4,000, we got to the very small number that actually were addressing norms and the smaller number that were measuring norms. So just to put sort of Anne's comments in context, that we have a big challenge ahead of us in terms of really understanding how norm shifting interventions work, because the evidence base is very thin. I also just wanted to mention that we will be sharing out to everyone who registered for the webinar these slides and also the policy brief, or the brief that summarizes these data for all of you, so that you can have it and use it in your work moving forward. Thanks, everybody.
Thank you, Rebecca. Yeah, I see Anne is clapping. So are there any other burning questions? We are limited by time and I'm conscious of time. I don't know, I think for our information, Maybe some comments for us to note. Harriet Ndagire is saying UNICEF and UNFPA developed the ACT framework. And I see Immaculate confirming that I find having the community context as part of the manual as working for that particular place. Okay. Great. So, is there any one burning question? As we come to the conclusion of our discussion, please feel free to raise your hand. Anyone from the audience? We have already lost some participants, so I don't want to move this any longer. Would like to really come to a conclusion. If you have any question, but before that question comes in, I want to recognize the presence of quite a number of people here and to thank many of you who have joined us for this meeting or webinar, as we called it initially. I see people from UCSD, of course. I see people from MTOI, Dr. Edna Harriet, Maureen Buyu, Regina, Geoffrey Nsubuga, Regina Bafaki. I think this Bafaki is from Oxford, if I'm not mistaken. Thank you for joining us. Immaculate Rono, Hakim James, AFHI, Immaculate Mukasa, Tatu Nyange, and many others. Please, thank you for joining us. If there are no any other questions, allow me to hand over to the Secretariat, in particular to Moses here for our closing remarks. Moses, please.
Yes, thank you, Dr.
There is one hand before you come in.
Okay,
Do we still have time?
Just 1 minute.
Okay, 1 minute. Hakim, please, you raise your hand. Please ask your question.
Yeah, thank you so much. Mine is not a question, but just an appreciation.
Yes.
In 1 minute, I can say, yes, when it comes to engagement of men and boys, it is truly very, very low. And as I talk, we had a program that we are doing already in the refugee camp, I think supported by Girl Rising in Kenya. And we were talking about the menstrual stigma. So we were really deeper into involving almost the boys all plus the men, so that we all talk together about the issue of menstruation. Because according to my finding, I found out that it is in the schools, meaning the schools only target the girls to talk about menstruation. They leave the boys out. So for this case, for us, we are saying no, we are not leaving boys out, but we are involving all of them so that they also learn what it means by menstruation. And now we participate now heavily in the issue of stigma. So meaning we should be involving now the boys, we should not leave them out, and we should not also leave the men out, because it is them that we need to talk to so that these girls attend classes without any problem. So if a girl fails, meaning the whole nation also fails. And I am also facing a stigma because I lead a community-based organization called what? Girls Empowerment for Community Development. So when funders come, they will ask, is it a women-led organization? So definitely I sigh out and I say, no, it is not a women-led organization, but our programmings target what? Girls. But mainly sometimes we see that people move away from supporting girls. So this is also something that is already happening. Let's copy everything. Okay, someone is participating to destroy a very big norm. So we should not dip ourselves into is it a woman-led, or is it a man-led, or is it a youth-led? So it is having its programming, they planned it, and they have to make sure that this is achieved. In Uganda also I've seen, is it care, not care, but one of the organization is supporting the community by training community activists to talk about the issue of gender-based violence. So I really picked interest, and it was really something very interesting. And I am seeing the community changing from their programmings. So thank you so much. I don't want to waste much of the time. I am from Uganda, BDB, the refugee settlement.
Okay, thank you, Hakim. You didn't say which organization?
Empowerment for community
Girls-
development.
Oh, thank you,
Girls
thank you.
Empowerment for community development.
Okay,
Yes.
great. Okay, I agree with you on that. Maybe we need to use more of the male engagement strategies in our work. And I think the Ministry of Gender also developed a male engagement strategy for gender-based violence, in particular, to guide in some of these issues. If you can visit it or use it, it's on their website. There are various ways we can engage men and boys in these interventions. Okay. I thank you again, and let me hand over to Moses for the closing remarks.
Okay. Thank you, Dr. Asabo. And I can see that nearly half of our participants who registered from the beginning have so far left, nearly. But I want to, first of all, appreciate those who have endured with us for close to 2 hours. And it shows that you are actually very interested in this work on social norms, on gender. And I also would like to extend a vote of thank you to our presenters, the analysts, the research analysts, that is Dr. Aloysius, Professor Walakira, Dr. Ann, and Dr. Rebecca also, who has joined us from the University of California. Thank you so much for the great work. Yes, Dr. Rebecca from University of California and the team. Princess, yes. So a lot of work has gone into this work, I think, for the last close to a year in making sure that this study was engaged in a process that is credible to the extent that these results we are sharing today, you can be able to see it. And this work is part of the work that EALC engages in. I think we had highlighted the 4 areas. One of them, of course, is documenting evidence, and we want to continue doing this. We appreciate that you are part of the EALC, and we want to encourage you to reach out to us. Our website, I think it has been shared. Our social media platform handle has also been shared. Please get to know more, which is ongoing in the work of the EALC. And we all know that social norms impact, or it is an aspect that can be integrated in a number of interventions. Of course, we know that it mainly promote violence, but also we know this can also impact agriculture. I saw a comment from somebody who is working in the area of agriculture, and also trying to make comment that actually there is also norms affecting areas to do with who controls the resources around production. And also there are crops that are being labeled, these are for women and these are for men. So these are some of the issues that actually affect social and economic progress of the population in any part of the country that we are dealing in. And therefore we are very committed in doing more research, and that should inform practice, and also building capacity of the practitioners, and also supporting the work of policy to transform norms in the entire countries. I want to appreciate you again, and thank you so much. We have come to the end of our dissemination. We shall be sharing this report on our different social media platform, but also on our website. We will make sure that the report is available for further access for you to read through and use it as part of either the intervention or to inform further research. Thank you very much. I want to thank you. I think we can now close this. Bye-bye.
Thank you, Moses, for those closing remarks. I think with that, we've come to the end of our dissemination seminar or webinar, if you want to call it. Once again, we thank all of you for attending, and please come again next time. in bigger numbers than this, and feel free to ask anything from the Secretariat, the report. All these documents will be shared on some of the social media handles, as Moses has said, and on email by